Doctors have got apparatus that allow us to measure the airflow. And if we do it at different times or under different circumstances, we can then measure the fact that the airway resistance is fluctuating. So, for example, you may come to your doctor who puts you in front of a lung function machine, gets you to blow into it, looks at the measurements, and then gives you a bronchodilator and asks you to wait 5 minutes. You then repeat that test, and there may be a marked sudden improvement in your airflow. If there isn't, and he still suspects asthma, and the test shows that although you didn't rapidly improve, you've still got parameters that indicate that there seems to be some airflow obstruction, he may give you a course of cortisone to use for a week or two and get you back. And after 2 weeks, if there's a marked improvement in your airflow, that could be asthma. You can do a bronchoprovocation test where you measure the airflow, then you expose the person's airways to medications that tend to close the airway down. And a normal person's airways will only close down at very high concentrations. But an asthmatic, at very low concentrations, the airways close up very quickly, and the doctor can measure that. You don't need to be afraid, because if your airways close down, he can quickly give you a bronchodilator and bail you out of trouble. So alternatively, your doctor may give you or the parents a peak flow meter where you can do your own airflow measurements at different times at home. And for example, if there's a huge variation between the peak flow in the morning versus the late afternoon or the evening, that would also indicate asthma. Or the person may do it after exercise. And again, if there are huge drops in the peak flow, that can indicate asthma.